Bonjour à tous.
Hello, everybody.
Je demande quelques secondes pour
Bear with me for just a
mettre
few
en
seconds.
position. Voilà. Bonjour,
That's
bienvenue
it.
à tous.
Welcome
Merci
to everybody.
d'assister.
Thank you very much for attending this.
Attendez, j'ai une petite chose à
I'm
faire
sorry,
au
there's
niveau
one more
de
thing that
mon
I need
écran.
to do.
Donc, je sais pas si vous
That's it.
voyez bien, 30 ans
Can
de
you see
recherche avec
me?
ELA.
30 years
Merci
research with
d'assister
ELA. Thank you
ce
for
deuxième colloque
attending
pour
the
les chercheurs en
second
webinaire.
international meeting
Nous étions, nous
between
sommes
the families and the
270
researchers in the
participants
webinar
inscrits,
format.
représentant
270
une
people
vingtaine de
registered
nationalités différentes,
from
ce qui est
20
la preuve
different
que ce
countries,
format qui
which
s'affranchit des
means that
souffrances et des
this
frontières
new
est une
format
bonne solution. En tout
is a
cas,
good
il aide bien.
solution. No
Je
more
tiens à
borders,
remercier tout
no
spécialement et
traveling.
très
And I would like
chaleureusement
to
les
thank
médecins et
the
scientifiques
doctors, the
qui vont nous
researchers
apporter
who are
aujourd'hui les
going
dernières
to
informations sur leurs
help
travaux.
us today
Et
by
enfin, un grand
providing the
merci à
latest
l'équipe
information regarding
ELA
their
International
research work.
et à nos
And I would also like
partenaires
to thank ELA International and
Minorix
our partners,
Thérapeutique,
Minorix,
Orchard Thérapeutique,
Orchard
Poxel et
Therapeutic,
Vigile
Poxel,
Neuro
Vigil,
qui nous apportent leur
Neuro,
soutien et
because
qui nous
they
permettent
provide
d'organiser
us,
donc ce colloque
they
dans
provide
les
the
meilleures
financial
conditions.
support and they help us organize
ELA
this
a 30 ans
symposium
cette
in the
année.
best possible
Impossible
way.
évidemment
ELA
de
is
résumer
celebrating
30 ans de
its
recherche en 10
30th
minutes,
anniversary. We
mais
cannot
je vais au moins
summarize 30
évoquer
years worth of
quelques grandes
research
étapes.
in just 10
En
minutes, but
commençant
I'd like
par
to go over
quelques
the
mots
main
sur la création
milestones.
d'ELA, ça me
First of
paraît
all,
très
the
important,
creation,
parce que
how
c'est
ELA
les bases
came
et les
to be,
fondations, mais
because obviously
ça
that's important.
lit
It's
bien
the
ce qu'on
starting
souhaitait faire
point,
à l'époque
and
et ce qu'on
it
voudrait aujourd'hui,
summarizes what
les
we
étapes
wanted to
clés de
do
la
then and
recherche,
what we still
le
want to do
développement
now.
de cette recherche
Also, the main
grâce à ELA, et enfin
stages of the
quelques
ELA
programmes de
research,
recherche.
and finally a
J'insisterai
few
tout
research
particulièrement
programs. And
sur
I'd
la
like to
recherche sur
focus on
l'adrénoleucoscopie. Je sais que vous n'êtes pas
adrenoleukodystrophy.
concernés pour la
I
plupart
know
par cette
that most
maladie,
of you
mais
are
c'est un
not
exemple
directly
emblématique
impacted
d'ELA
by.
et vous
It's a
allez
very
comprendre
good
lors de
symbol
votre
for the work
réflexion.
conducted by ELA, so I will focus
D'abord,
on
quelques mots
this
sur la
disease.
création d'ELA en
How was ELA
1992, donc
created
30 ans
in
cette année. Cette
1992? So we're
photo,
celebrating the 30th
finalement, résume
anniversary. This picture really
les,
summarizes it all.
les tout débuts, en fait,
How
puisque
it
deux familles
started.
se sont
Two
réunies
families got
quelque part à
together
Nancy pour mettre les bases
in
de
order
cette
to throw
association.
the
Au centre, vous avez la famille Cordary
basis
avec
of
les
this
Raymond, avec
association, the
leur fils Julien
Caudery
qui avait quelques 7 ans
family
à peu
with
près
their
à cette
son
époque-là,
Julien, who
qui est
must have been
malheureusement
7 at the
décédé
time.
aujourd'hui, qui était
Unfortunately,
concerné
he
par une
passed away. He
adrénoleukodystrophy.
suffered from
Et sur le côté,
adrenoleukodystrophy.
Katie et
And on the
moi-même,
side, there is
qui
Katie and
avions un très
myself.
même âge.
Our son was the
Lucas, qui
same
était
age at the
concerné, qui est
time,
toujours
Luca,
concerné par une
and he's
adrénoleukodystrophy.
still
Voilà.
suffering from
C'était aussi
adrenoleukodystrophy
la première
today.
année
And that
et
was the
déjà
first year.
où nous avions cette volonté
We
de financer la
wanted
recherche
to
médicale,
fund medical
en plus du
research,
soutien aux familles, de l'information, de la sensibilisation de tous les publics
besides
et du
supporting the
développement
families and
international. Nous avons
working
lancé
on
dès
increased
92
awareness and international
une première
development.
appel d'offres
And in
recherche à hauteur de
1992, there
200
was
000
the
euros.
first bid
Les années qui ont
for
suivi, on a
project
augmenté
for
systématiquement
200,000
cette
euros,
dotation
and we kept
et
increasing
il s'est passé quand
the
même quelque
amount
chose
of the
d'important
funding.
que je
And something important
dont je voulais vous
happened
parler en
that I would like
2004,
to
puisque
mention
nous avons
in
eu l'opportunité,
2004. In
ça s'appelle vraiment
2004,
comme ça, c'est une
we
très
had
belle
an
opportunité qu'on a
opportunity. It
saisie,
was a
de créer
great
une
opportunity
fondation de
that we
recherche ELA. En fait,
actually
c'est
used to
l'association ELA
create the
qui a créé
ELA
cette fondation
Foundation,
parce que le ministère français de la Recherche
because the
a
French
suscité
Health
la création de
Ministry
nouvelles fondations
actually
de recherche
encouraged the
en
creation
apportant
of new research
des dotations
foundations
conséquentes
by
à
providing
celles et ceux qui
large
avaient créé ce
funding
type de
to
fondation.
those who were
Alors
in a
évidemment, quand
position
on a
to
compris
create a
que
foundation,
le
set up a
ministère de la
foundation. So
Recherche
when we
française
understood that the
était prêt à
French
nous suivre et que
Health and
chaque
Research
euro qu'on pouvait
Ministry was
investir
prepared
nous
to
était prêt à
support
mettre
us,
dedans,
and that
eh
if
bien, on
we
a mis la
invested
barre à
1 euro,
10
they
millions
would
d'euros,
contribute the
ce
same
qui fait
amount.
qu'en
We
2004, nous
set
avons
the
créé
standards
une
very high,
fondation
10
de
million
recherche
euro, and in
qui
2004 we were
avait
able
comme
to
cadeau de
start
naissance
a research
une dotation
foundation,
initiale
and
de
the
20 millions d'euros qui nous a
birth present
permis
was 20
évidemment
million euro, 10 from
d'augmenter
us,
nos
10 from the
financements en
ministry,
recherche
which
jusqu'à
obviously
atteindre
allowed us to
des
increase our
sommes
research funding until we
importantes
reached
pour l'époque,
very,
eh bien,
very
pour
high
aujourd'hui,
amounts.
puisqu'il
For the
s'agissait
time, it was very high
d'investissements de
amount,
4 millions d'euros
and
par
we're
an.
talking 4 million euros per
Là, cette
year.
photo, vous voyez le premier conseil et le seul
So
d'ailleurs
this
conseil
was the
de surveillance
first
de cette fondation,
board
sur
that we
lequel, sur
organized
lequel
for the
il y a des membres
foundation,
du conseil
and there
d'administration, des
are the
membres du
members of
bureau,
the
du conseil
board,
d'administration de l'association,
obviously
mais
the
aussi
board
des
of the
personnalités
association,
qualifiées,
but also some
dont
very
François-Henri
famous
Pinault, qui est
people.
le patron de
François
Paris. Pour ceux qui ne
Ripineau,
connaissent pas, tout le monde connaît la marque Gucci et c'est
for
un
the
groupe de luxe.
Gucci group
Juste à
luxury
ses côtés, au
brand,
caméra à gauche,
and
juste à
the
ses
left-hand
côtés, le
side
patron de Danone,
on the bottom
Franck Ribot,
line,
à
then the
droite,
Danone
vous avez Florent Pagny, un
boss,
chanteur,
Franck
et
Ribot,
au
and then on
centre,
the right-hand side
un
with the
des
beers,
parrains
Florent Pagny, a
emblématiques
famous
également,
singer,
qui est
and also
présent
right in the
depuis toutes les
middle, a very
informations et qui est toujours à
famous
mes côtés, c'est des méthodes
godfather for our foundation, the football player Zinedine Zidane. Obviously, these people have nothing to do with research, but they have the capacity and the will to help us, and they played a determining role in the setting up of the association, both because they helped us fund the foundation, but also because some of them provided us with counseling and advice. Then a next stage in 2015, we wanted to create ELA International. ELA International actually took over from the foundation. The idea was to speed up research by raising more funds and bringing together the patients and their families. The strategy consisted in giving ELA a very international dimension. And regarding the way this new body was organized, we started bringing together the European associations, Germany, Belgium, Spain, France, Italy, Luxembourg, and Switzerland, and we pooled our resources, our funding, in order to fund research. We also had to bring together researchers and patients. And so we started organizing every year a meeting between families and researchers, and also a scientific symposium for the researchers every 2 years. And in 2018, we developed a platform dedicated to trials and clinical studies, DuConnect, a platform that actually complies with the confidentiality European standards. And I really encourage patients, their relatives, their caregivers, or any researcher interested by this subject to open a personal account. Several studies have already been conducted with the help of DuConnect. Others are in the pipeline. I think it's a very good tool to help us develop more trials and organize more studies, because we're still lacking studies. And ELA International has provided us with more visibility, more resources, and we have been creating events to increase the awareness and the resources of ELA International to raise funds. For instance, Crystal Foot. Crystal Foot is a project where we copy the foot of a famous athlete. It's made from Baccarat crystal, a very famous brand. And they are very close to us. They support us. Baccarat is only 50 kilometers away from Nancy, so they're very close to us. And Zinedine Zidane, the football player and also our godfather, actually agreed to have his foot copied, and 18 of his crystal feet brought us 700,000 euros. And more recent, there was also the project put your trainers in the company, wear your trainers in the company. And finally, on the project, the Heart of Famous People, Beads for ELA, and you see some very famous athletes working for ELA. Here we have research projects that we funded. More than 30 leukodystrophies have been identified. 550 programs have been funded. Close to 50 million euros were invested. So this gives you an idea of what ELA has been doing regarding research. The starting point was leukodystrophy and the discovery of one or more genes responsible for the disease. And only after several intermediate stages, we can start a clinical trial in man. And for leukodystrophies, the trials are mainly divided in two approaches. The drug trials, we test known molecules, and gene therapies, we try to replace the defective gene by engineering the genes in the patient's cells. So here we see that we have invested 800,000 euros in drug trials. The Icardi-Gutiérrez syndrome, for instance, Professor Yannick Crowe from Edinburgh is testing inhibitors that inhibit the enzyme responsible for the disease. And the CASH syndrome, Professor Mojo van der Kamp is testing guanabans, a molecule that acts as an anti-stressing agent for the cells. Regarding gene therapies, the idea is to engineer the the cell, in this case, the cells from the bone marrow for leukodystrophy, metachromatic leukodystrophy, and adrenal leukodystrophy. We have known for some time now that conventional bone marrow transplants can give good results in some conditions. You have to have compatibility between the receiver and the donor. And one of the advantages with gene therapy is that we don't have any danger of the transplant being rejected, because we take the cells from the patient and we engineer the cells and we inject them back to the patient after we have engineered them. And it works. Two attempts have had success in metachromatic leukodystrophy in 2020 and renal leukodystrophy in 2021. In both cases, the market authorization was granted. On this picture, you see Colleen, who is actually tickling her older sister, who seems to be the smallest one, obviously, but she's the oldest one. And Colleen had a transplant, a successful transplant in Milan in 2020. Unfortunately, Alice, who was diagnosed too late, could not benefit from the bone marrow transplant. As I said in my introduction, I want to focus on adrenal leukodystrophy, ALD, because for us it's a symbol. ELA originally was created by families whose relatives' children suffered only from adrenal leukodystrophy. And following that, the association started working on all the other diseases. But initially, we worked on adrenal leukodystrophy, and we dedicated 9 million euros to the research. We went through all the stages from discovering the gene, 800,000 euros in the 1992 bid for projects, helped us understand the role played by the gene in the cell's operation. And in 1995, we tried to transfer the gene in skin cells taken from the patients. In 1998, we performed genetic correction of bone marrow cells. In 2006, there was a gene therapy trial in the mice. And finally, in 2009, the gene therapy was successful in 4 children suffering from cerebral adrenal leukodystrophy. And until 2009, ELA was the only private partner, the only association to supporting the research. Fortunately, in 2010, and starting in 2010, a second trial was started by an American biotech company, Bluebird, and the trial was identical to the first one, and it confirmed our successful results in 2009. 2021, the gene therapy for adrenal leukodystrophy, the cerebral form of adrenal leukodystrophy, was authorized by the European Drug Agency. And then, question mark. And then, after so much hope, 1 month after the market authorization was granted, that was July 2021. In September, so about a month later, the Bluebird pharma company decided to pull out of the European market for financial reasons. That was very disappointing. And there have been negotiations regarding reimbursement with the European health authorities, and apparently it didn't work out. Obviously, the therapy costs 1.5 million euros for each treatment, and that's a very high amount. And as a parent, I am absolutely I think this is a scandal. I mean, this is really, the health authorities have stopped the discussion rather than blaming the people who are responsible for this disaster. We should make sure that the health ministries and authorities will resume the negotiations, because the price to pay will be human lives, children who could not benefit from the therapy. We're not even talking about money anymore. Why am I focusing on this? Because I know that many families are watching this. Gene therapy, I mean, this is a very good example. It has happened elsewhere. There are other forms of leukodystrophies for which a gene therapy could be the solution. I don't want this disaster to happen again. This awful situation really should help us understand that we need to prepare so that for the next trials and the next gene therapies, things go well and we don't have this disaster again. I don't want to part ways without a message of hope. Gene therapy for adrenoleukodystrophy works. It is a success. And there may be others. There are many more trials in progress. And look at this table. Look at this. Have a look. There are approximately 15 trials in progress, and they're not all in this list. Regarding leukodystrophies, all kinds of leukodystrophies, they're either in progress or being prepared for the Aicardi-Gouttière syndrome, for Alexander's disease, for Canavan's disease, for Krabs disease, for the Cash syndrome, and as I said, also adrenoleukodystrophy or adrenomyeloneuropathy. I am aware that we still have a long way to go, and it's not going to be an easy path. There is a controversy on the gene therapy for DPA, and this is going to be a difficult discussion, but I hope I have convinced you that we really need to stand united so that we can have a weight in those decisions in the future. Thank you very much for your attention. Thank you to all our partners, Minorix, All-Child Therapeutics, Poxel, and Visual Neuro, for all their support in the organization and the funding of this symposium.